contractility. The next form would be distributive shock. So examples of that is sepsis and anaphylaxis. So here, what I have is a normal blood vessel, so prior to any disturbance. So blood is traveling through. It wants to leave, but it can't because there's various forms of occlusions and tight junctions. And so there's laminar flow through the blood vessel. Now, some form of disturbance occurs, whether it be a gram-negative bacteria or histamine release, whatever it may be, it's going to cause an increase in vascular permeability. So what that means is that the distance between each of the endothelial cells becomes so large that fluid is able to escape. And so fluid is no longer in the vascular system at all. So likewise, as we saw in the hypovolemic, there's going to be a reduction in circulating blood volume, right? So in this instance, different from before, let's start at the level of the blood vessel, because that's where the disturbance itself is occurring, right? So at the blood vessel, what do we have happening? So let me quickly write this out. So then we have arteries and veins as well, right? So here we have already said that because of whatever the disturbance may be, the vascular permeability is increased. So an increase in vascular permeability is another way of saying that there's going to be dilation. So there's increase in dilation of the arteries, and there's going to be increase in dilation of the veins. Now this is interesting. This is different from the other ones, right? Now by dilating the arteries, what are we essentially saying? That the heart now has to pump against less of an opposing force. So if there's less of an opposing force to the heart, that means that the afterload will be reduced, right? So a reduction in the overall pressure of the system, so systemic vascular resistance is reduced. If there's a reduction in systemic vascular resistance, and since there's no actual abnormality to the heart itself, so the functionality, its ability to contract has remained the same, that would mean that the cardiac output actually increases. And that's the first time that we see this. So that's interesting because of the fact that there's dilation as opposed to constrictions as we've seen in previous ones. And likewise, the dilation within the veins will cause a similar phenomenon to occur, but in the reverse situation. So we're going to see a reduction in central venous pressure. And the reason for that is because now all the blood is pooling within the veins, within your legs, basically everywhere that's away from the heart, because before we had the veins contracted. And because they're contracted or constricted for that matter, it does that creation of a pump. But now we're doing the reverse. Now we're no longer pumping, now we're dilating. So now we're pooling all the blood. And so we see a reduction in central venous pressure. And because less is returning back to the right side of the heart, we expect less to return to the left. And so we also see a reduction in the pulmonary capillary wedge pressure. And so now we have discussed all the various points within the distributive shock. Now the last one is obstructive. So I'm just going to take tapenade for the example, right? So here what we have is a heart, and around it is the connective tissue, right? And so whenever there's an increase in fluid of whatever composition along the outside of the heart, that fluid is going to have an inward pressure, right? So it itself is exerting a pressure. So then when blood is coming back into the left side of the heart, likewise the right, it doesn't really matter, but I'll just take the left side as an example. It's coming into the left side of the heart, it wants to expand, but now that there's even if there's a minuscule amount of fluid in here, it's going to exert some force. Therefore, its compliance is no longer to the same level that it once was. So it cannot accept the same amount of fluid. If it cannot accept the same amount of volume as before, then that means the volume that leaves is also going to be less. So now that again, the problem is geared towards the heart. So we have again a reduction in cardiac output. We go through the same system where a reduction in cardiac output means that there's a reduction in volume. A reduction in volume, and another way to verbalize that is to say that there's going to be a reduction in pressure. A reduction in pressure is going to then be detected by the baroreceptors within the aortic arch and in the carotid system. There's going to be a reduction in firing. Basically, the body's going to realize that we are not having a sufficient perfusion of the system. The blood pressure has been reduced. We need to now increase it. And so the way that the body responds is by increasing the sympathetic nervous system response. Again, it's going to attack two various regions. One would be the vasculature, and then the other is going to be the heart itself. And as we've discussed prior, the arteries and the veins. The arteries will become constricted. Likewise, the veins will become constricted. And as a response to the constriction of the arteries, we're going to have an increase in the systemic vascular resistance because the afterload now increased. So now the heart has to pump against a stronger force, opposing force. And likewise, within the veins, what happens is through the constriction of it, we have more of a return to the right side of the heart. And so the central venous pressure will increase. And as a response of more blood coming to the right, more blood has to subsequently come to the left. And so there's going to be an increase in pulmonary capillary wedge pressure. At the level of the heart, a similar phenomenon will occur. As in the previous examples, what's going to happen is that the heart will begin to beat faster, right? So there's going to be an increase in heart rate, and then in the actual heart cells, the myocardial there's going to be an increase in contractility. And just to quickly explain one last phenomenon. So here, within the sepsis, within the category of distributive shock, because there's going to be vasodilation, there's going to be vasodilation systemically, right? So that includes the peripheral system. And so since there's going to be dilation within the peripheral system as well, the individual is no longer going to feel cold. It's no longer going to feel cold, right? So instead of, as in the various other forms, the individual is usually typically cold because there's constriction of the peripheral vasculature system. However, in this, there isn't constriction, there's actually going to be dilation. And since the temperature of the peripheries are determined by the vasculature, the dilation means there's going to be more blood flow. And since blood is typically considered warm, the extremities are also going to feel warm as well. So essentially, if we just go back to this image here, the ups and downs are determined based on whatever the disturbance is. But this is the basic formula as to what occurs and then where it occurs in various forms of shock. I hope this helps.